We have initiated a very broad communications campaign with primary messaging focusing on awareness, personal protection against mosquitoes, and residential sourced reduction. That's a fancy word for what we're now calling tip and toss. Don't have standing water in your yard. Tip and toss. Weekly news, media conference calls. Many of you have probably heard me on the radio since January talking about the Zika virus and what we've known as it goes along. Providing regular updates, piggybacking on national news stories, always reporting confirmed cases within the news, including prevention messages in all our communications, and we've conducted social media, television, and radio campaigns. Some of those are under development. As you probably can imagine, those kind of things are very, very expensive, and given that we have less money than we started out with, it's harder to do things like that. However, again, our communications department is really pulling together and trying to do more with less. Obviously, if Zika was a funded activity, then we could do more with more. Again, one of our main communication focus has been on pregnant women. Those are the ones we're really worrying about, the developing fetus and the risk of microcephaly. We have aligned our communications with our OBGYN outreach plan that I'll talk about in a minute. We've deployed targeted communications to pregnant women in impacted areas, basically the southern part of the state, but also through OBGYN providers. Last week we provided a really targeted campaign with 4 waiting room posters to every single OBGYN provider in the state of Louisiana, talking to those pregnant patients with posters in the waiting room about if they go on vacation, how to protect themselves against mosquito bites, and importantly, we always get the question, what mosquito repellents are approved for pregnant women and which are not, and so communications about that and education for them. It's not going. Let me try that. Is that better? Is that better? Okay. One of our other main groups is vector control. What vector control means is mosquitoes. Here's a map of our mosquito control districts within Louisiana. What I want you to focus on is the southern part of the state there, where we not only have the Aedes aegypti mosquito, but the green represents our best developed and comprehensive mosquito control districts. And so fortunately in Louisiana, where we have this particular mosquito, we also have very, very good parish level mosquito control. As we go north, there is less mosquito control, but what I have learned since January is Louisiana prioritizes mosquito control, and we certainly have well-developed mosquito control compared to other states. And fortunately, it's in the southern part of Louisiana where the Aedes aegypti mosquito is expected to be prevalent. Unfortunately, with the Aedes species, they're difficult to trap and control. I guess they're very, very small. Trapped mosquitoes are poor predictors of abundance, infection rate, and risk assessment. And large areas of our state lack knowledgeable mosquito control experts. Obviously, with mosquito control, funding brings response to an outbreak. I talked about this before. We're doing 2 forms of surveillance, first in people. We're recommending that people who have the Zika virus stay in air-conditioned, screened accommodations, use personal protection so that they don't get mosquito bites. Consider conducting household door-to-door surveillance for clinically compatible cases, making sure we know everyone in an area who has the Zika virus, and enhanced local surveillance for human cases. And we talked about that before in our enhanced surveillance. The second is vector surveillance itself. Surveillance for the Aedes species in a 150-yard radius from the block of a case patient. If we know somebody has the Zika virus and we suspect local transmission, we're going to want to know who else has it and if there are any other mosquitoes within that area, or mosquitoes at all. Someone could have traveled somewhere else and got it and come back to their home. It may in fact not be there. If possible, conduct a rapid insecticide resistance study for any of those mosquitoes that we do find. and conduct larval and adult mosquito control in a 150-yard radius from the block of a case patient home, including residential habitat reduction, that's both inside and outdoor space spraying where possible. This is really to cut down those mosquito populations around a case if and when we find one. And then also door-to-door educational campaigns. We currently have these kind of campaigns going on in general. Even though we don't have local transmission, we do have campaigns going on within lots of our mosquito control districts, that tip and toss campaign, encouraging people to get rid of sources of water within their yards, especially after a day like today. The one thing I encourage people to do is remember that mosquito reduction and source reduction is not a one-time thing. We can't tell people in May, oh, go reduce the water in your yard, and you're sort of done for the year. It's not like cleaning your gutters or anything. You really have to do this once a week, as we saw from today. Anyone who did source reduction in their yards yesterday or the day before, it's all going to be full of water today. So really, once a week, we want people to make sure that they reduce standing water in their yards. So I'm going to talk real briefly about blood safety. There is a risk of Zika transmission if someone with the Zika virus in their blood were to donate blood, organs, things like that. We have been in communication with all of our blood centers within Louisiana. We have exchanged guidance with them. Fortunately, in Louisiana, we have really well-developed blood collection systems, and I think possibly that was a result of the multiple hurricanes and disasters we've had in Louisiana. But there is a very well-established blood collection system here in Louisiana. We have communicated all recommendations with them. The main recommendation that we're currently going on for all blood centers is if someone is donating to one of these centers and they have been to an area of Zika transmission, they need to wait 28 days before they donate blood. That allows the infection, the actual virus, to get out of their system. But in addition to that, all blood centers within Louisiana are moving forward with a test that would test for the Zika virus and directly within the blood supply. And I believe 3 of the 5 major centers are already possibly using that, and all 5 will be up to speed soon. So not only do we have that first line of defense where we say don't donate for 28 days if you've been to an area of active Zika transmission, but then also that second layer of protection, we're going to start testing the blood supply and making sure that there's no Zika in there. And then finally, with blood safety, I'd like to say if things did get really, really bad, we would just stop all blood collection in Louisiana if there was local transmission. And in that case, we would need to partner with other states and other places that did not have local transmission to supplement our blood supply. I don't know if any of you have seen recently on the news, but on most news channels and several television stations, the Baton Rouge area and southern Louisiana, and even all of Louisiana, is running a little bit low on our blood supply. Many people have seen the little ticker saying if you would consider donating blood. So I just want to put that message out to all state employees that if you have ever considered donating blood, now is the time. Louisiana is having a little bit of a shortage, and just knowing there is no risk of getting Zika if you donate blood. I'd like to say that, but also, support blood donations and just know that the blood supply is safe from Zika. So the last category I'm going to talk about is pregnant women. And as I have said 3 or 4 times during this presentation, this is our main focus in preventing Zika. It is to prevent birth defects and miscarriage in pregnant women if they were to get Zika. We have multiple channels and avenues by which to communicate with pregnant women and their providers. Preconception planning, women wanting to become pregnant, or even women wanting to delay pregnancy throughout if the Zika virus was spreading, or through mosquito season for that matter. Counseling towards pregnant women, travelers, or women with returning traveler partners. Remember, a pregnant woman, if she has a male partner who returns from the Americas and there is active Zika transmission there, there's special guidance for them not to have unprotected sex after that, because there is a risk of the Zika virus transmitting from that man to that pregnant woman. And then also increased risk during local transmission and testing. So we have avenues to contact pregnant women directly, provide guidance, education, and resources, Zika disease and congenital birth defects, mosquito prevention. Obviously, we want pregnant women to avoid mosquitoes altogether, information about sexual transmission, as I talked about before, and then how to protect themselves outdoors and protect themselves from mosquitoes. Not only using clothing, but pregnancy-improved insect repellent as well. And then third, our strategy has been to educate the general public about the risk to pregnant women. Guidance, education, and resources. Again, the main risk of Zika is to the fetus of a pregnant woman. We have done outreach to all primary care providers who treat women of reproductive age. This includes that entire list that I talked about before: internists, pediatricians, midwives, nurse practitioners. We've got a program in pharmacies now to try and really target women who are pregnant, but also target women who are considering pregnancy during mosquito season as well. And then to everyone at large in the general public, the main message is mosquito reduction. Community mosquito reduction protects pregnant women. Anyone who goes out and does the tip and toss campaign protects their neighbors, protects, and you know, if we can, 5 blocks away, eliminate mosquitoes and prevent transmission, it prevents it from neighborhood to neighborhood, possibly winding up with a pregnant woman. So really, mosquito prevention is really the key to preventing local transmission. So things we're moving towards in the future, again, we're using some of our very limited funding to target pregnant women. Zika prevention kits for pregnant women. This includes information, it includes insect repellent, it includes what clothing to wear, condoms, insect repellent, things like that, and mostly educational material to protect pregnant women. We're working with OB/GYN providers to have contraception and training resources for providers, widespread distribution of advisories to men about condom use if they're returning from the Americas to not infect a pregnant partner, and also broadening our outreach to our pregnant patients and their providers using non-English speaking materials if that's appropriate. So where we are in the Zika virus threat, for the past 4 or 5 months, we've been planning. I have to be honest with you, in January, I had no idea what the Zika virus was. I had never heard about it. So to get the state up to speed, to build together a coalition for each of those 6 planning stages that I talk about, I have a team of people led by an expert, many of whom are here in the room today, coordinating a group of people working on Zika planning and now prevention. As I talked about, what we're in now, we're prevention. We want to educate people, the public, pregnant women, using vector control and epidemiology and surveillance and laboratory testing to prevent local transmission. I certainly hope that we never get to the place where we have to respond to cases of local transmission. But that's what we have been preparing for the last 5 months. So the main message I want you to leave you with is prevention. Let's all participate in that tip and toss campaign, making sure that our yards are free of standing water, and stay educated and up to date on current Zika information. And then I will take any questions from the room. I think we might have gotten a few questions from the email. Any questions in the room?
You said going forward, we're considering testing for Zika before blood donation. Who would foot the cost for that blood test?
Okay, so what that actually is a test for Zika after blood donation. We have a 28-day ban. Anyone returning from the Americas should not donate for 28 days. But even if somebody does donate, there's a blood test that can be done. Now, again, the cost of that blood testing is going to have to be absorbed currently by the blood centers. There is no funding for that. However, we do expect that if Congress moves forward after the recess, some funding will go towards blood testing.
Second question, do we currently, Medicaid, do we currently pay for the testing, the blood tests that are being run?
So we did receive a small supplement from the federal government, the PHEP funds. A significant portion of that is going towards laboratory testing.
Thank you.
Any other questions in the room? Okay, I don't believe we have any questions on the internet, but what I will tell you is this presentation and any questions and answers that we have following this presentation will be posted on the internet for viewing later. And thank you all for participating. Thank you.